This is the Emergency Medical Minute.
But I do have a quick, we recently had a journal club, so I know a couple of people were there. One of the articles that we talked about was pulmonary embolism in pregnancy in a recent trial that came out of the Netherlands where they were trying to adjust the D-dimers to kind of higher thresholds. Since we do know that pregnancy, just normal pregnancy, increases your D-dimer, we kind of, would like to be able to increase that threshold of what's still considered normal in a pregnancy. If we back up, like blood clotting in pregnancy is probably overhyped a little bit. Pregnancy is a hypercoagulable state. There's no denying that. But I think there is always this kind of immediate concern, like, oh, somebody has a swelling in their leg or they felt a little short of breath, and it must be a blood clot. And really, in reality, that's not the most likely diagnosis in somebody who's pregnant. It is a consideration, but when we look at the incidence of blood clots in pregnancy, most meta-analysis put it somewhere close to like 3 in 10,000 patients. And most of those are actually peripheral DVTs, not pulmonary embolism. So it's really probably closer to 1 in 10,000. It's still a risk that's there and still not something that you want to miss, but the average pregnant person is a healthier patient. It's a healthier patient population where their body can compensate for some extra clotting and kind of help break that down. So what they're trying to do is find out what's this normal threshold, how can we adapt that? And so they took this called YEARS algorithm, which is used in adults. We don't use it much here. We stick a lot with like Wells score as well as like PERC rules and other stuff. But bottom line is it takes the D-dimer and increases it from 0.5 up to like a solid 1, so an even 1. And they were looking at can we go up to this threshold and call it safe. So in somebody who has like no obvious clinical signs of a DVT, they have no known DVT anywhere else, they don't have any hemoptysis, and your suspicion of like PE is pretty low, if you do that and you run a D-dimer on that patient, you can go up to 1 according to the study. And in the study of about 500 patients, there were no blood clots missed. These 500 patients were not just anybody who's pregnant. All those patients were pregnancy, and they were referred for high suspicion of a PE, or for suspicion, rule out PE. And so of all those patients, the ones who they followed this algorithm, including the D-dimer going up to 1, there was 1 missed, and it was a popliteal DVT of no consequence that was found later on follow-up. No pulmonary embolism was missed or anything else. It's kind of hard to say that this is definitely ready for prime time, but I think we're definitely going to see the trend go with it, where we kind of push out what's normal D-dimer for patients. There's this other guy who's kind of the guru of blood clots in emergency medicine, and for years he's been advocating in third trimester pregnancy to go up to 1.25. So I think we're definitely going to see what that final target is. I'm not exactly sure, but I think we're going to see it get closer to that. What is interesting, of all the patients they took that were in their third trimester of pregnancy, they ran a D-dimer on them. Of those, I don't know the exact number, it's 200 something. Nobody had a D-dimer less than 0.8. So if you have somebody who's in their third trimester and you order a D-dimer, you kind of know it's already going to be above 0.5, which is our threshold right now. So something kind of has to change is the bottom line. We need to figure out what's safe and what's normal, but we don't want to radiate every pregnant person who comes in with a CT or a VQ scan. So that's it. Hopefully more to come on that. So.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.